Okay, my name is Tikva from Homeopathy for Humanity, and I am here with Sanjay yet again. Say hi, Sanjay.
Hello, I am Dr. Sanjay Solanki from Central Maharashtra and I am practicing homeopathy.
And I'm coming to you from Northern Israel, and I am also a practicing homeopath. Okay, so we have here this nice book called The Chronic Diseases, which is actually like an extension to the Organon. We've all read the Organon, I'm sure, and if we haven't, we know where to go to find more information on how to learn Organon, as we have a couple of different groups on Organon. So here, this is like an extension. You know what an extension is? Something that gives more details. So in 1837, Hahnemann is telling us in the second part of the chronic diseases, the antisporic medicines, he gives a preface concerning the technical part of homeopathy. So in I keep thinking 1937. In 1837, he gives us some new information about dosing. And his dosing is very interesting in the chronic diseases, because when did the sixth organon come out? Like, when was it written? I know when it come out, but when was it written? Does anybody know?
Sixth organon 1921. But
And
it's finished before death of Hahnemann.
1842, na?
1842.
I think 1843, sir. 43.
Death was in 43, but 1942.
Yeah, Hahnemann finished all his writings before 1 year of his death, sir.
Yeah.
So in the preface, he tells us various things about how to dose our patients. He calls this the technical part of homeopathy. So he's saying that this is very technical. And it's very fact-based. And he goes to say, the dry dose is the weakest dose with the shortest action, as is the simple olefaction. So he's saying that dry dosing is weak and has a short action. Olefaction is also weak and has the short action. And it is best suited for slight acute ailments. What do we think about that? The dry dose and the olfactory dose, best suited for slight acute ailments. Is that interesting? Why would that be? Oh, page number. The page number of my book, everybody's book is a little bit different, I think. But you see there's the second part.
This book, 155.
And this book is 261. But it's underneath the second part, antisporic medicines. Okay, so the dry dose and the olfactory dose is the weakest dose with the shortest action, and it is best suited for slight acute ailments, according to Hahnemann. Nevertheless, now I'm going to quote Hahnemann here. Nevertheless, the incredible variety among patients as to their irritability, their age, their spiritual and bodily development, their vital power, and especially as to the nature of their disease, necessitates a great variety in their treatment and also in the administration to them of the doses of medicines. So he's saying here that our choice of how we dose our patient depends on how irritable they are. He doesn't really mean nervous. He means more like susceptible to influences. Their age, their spiritual and bodily development, which could mean things like, are they city people? Are they rural people? This can mean a whole lot of different things. Their vital power, we understand that part very easily, whether or not they can handle a lot of dosing or not, whether or not their vital force is very strong. And especially, he says, as to their nature of their disease. So according to the nature of the disease, this gives us options of how we dose our patient. And remember, in the first part, he says that the dry dose is the weakest dose with the shortest action, best suited for slight acute ailments. So he goes on to tell us that he gives us a long list of things. And then he says, I can only limit myself to the latter case, which he means chronic disease messed up by allopathy. That's one of our types of disease that we treat, which is extraordinarily common where we live today and how we live today, because who hasn't had a variety of different allopathic things happen to them? People start getting their shots at birth and whatnot. And of course, that affects the vital force, even if it doesn't necessarily give them an ailment per se, it affects their vital force. So he's saying that he will limit himself here in this book, The Chronic Diseases, under how to have, dose our patient to the situations where allopathy and has become a medicinal disease along with the chronic disease, which in most cases is flora and not a venereal disease. So as to the other situations, it cannot be arranged in tabular form. So he says he cannot give like a flow chart for how we need to dose the patient, because it is so flexible depending on the needs of the patient that he says that the tabular form, i.e. the flow chart, would be for the weak and negligent. Woohoo, strong words from Hahnemann again. Everybody's talking about, well, how do we give this patient? How do we give that patient? Everybody's got their flow chart. Everybody's got their thing. If the patient's this, if the patient's that, give this, give that. Hahnemann says, no, no, no. That's for the weak and negligent to have some kind of thing like that. And he's not even going to go there with us. He's not going to go there. That is not applicable in Hahnemann's mind, because we have to be proficient and be able to read our patient and their needs and make those decisions ourselves, and not be weak and negligent and depend on flow charts. But we must be left to the, so how we dose the patient, I'm continuing here with Hahnemann, must be left to the accuracy, the industry, and the intelligence of able men who are masters in their art.
Means homeopath himself,
Yes, the homeopath himself.
a skill of a homeopath.
Mhm.
So how he will dose according to the disease condition, a disease state, right?
Exactly that.
Yeah.
How are we going to dose? He says that he
Okay.
cannot give us a tabular flow chart because that is for the weak and negligent, and that we must have the skills ourselves and the industry and the intelligence to be able to be masters of the art of redosing. Okay, guys, we got that.
Any questions? Which part of organ he has mentioned about this thing, how to use doses, repetition of doses? We are talking about doses. Means in acute condition, in urgent emergencies, and in chronic state. He has explained in very nice format in this book, but in organon he has given the brief about the state, and it's in 248, right? Where he mentioned you can repeat in urgent cases doses every hour, every couple of minutes. In acute, every hour, right? And
And in
2 hours.
cholera, really, really frequently. Yeah, so it is aphorism 248. That's right. And he reiterates a lot of the same things, but not only the same things in the chronic diseases. He says here that in chronic disease, I have found it best to give a dose, for example, a spoonful of a solution of the suitable medicine at least every 2 days, more usually every day. And then he tells us again, just like he does in the organon, before proceeding, it is important to observe that our vital principle cannot well bear the same unchanged dose of medicine to be given even twice, much less more frequently to a patient. For by this,
when was this preface written?
when was this page written?
This
is-
preface, this section of the book.
Oh, I said already 2 or 3 times, 1837.
1837 means it's during that phase when he write sixth organon.
But he's still dealing with C scale because the information on LM potency has not been released to the public.
Yeah. It was
then he gives
released in
us-
sixth organon, which was completed completed on 1842. So
Yes, sir. He mentioned
this, whatever, yes.
he mentioned the last 5 years of his life. That is from the 1837 to 1842.
Yeah, 1837. That's why I asked when this was written.
The key
Yeah,
point being
but,
that this was
key-
written before the sixth organon.
Yeah.
Yeah, so he's saying here that the dose cannot be repeated twice. The same dose cannot be repeated twice. There are things you have to do to the dose before we can repeat it. And that is, it needs to be in a water dilution. And it needs to be, he says here, shaking. Because this isn't LM potency, this is C scale. So water dilution, shaking. And then he goes on to say some other things that we'll get to soon. But we have to bear in mind that the body does not accept the unchanged dose, the dry and unchanged dose. Thus, even a well-selected homeopathic medicine produces ill effects and attains its purpose imperfectly or not at all. Thence come the many contradictions of homeopathic physicians with respect to the repetition of the dose. So he says that homeopaths have a lot of conflict about the repetition of the dose. So Hahnemann is here telling us you don't need to have a bunch of conflict about the repetition of the dose because we are giving you guidelines here. He gives us more or less kind of standardized guidelines about chronic disease. And one of the main things is that we never repeat a dry dose, and that the dry dose is the weakest dose with the shortest action, which is really interesting, especially considering that so many people are still dry dosing.
Which is weakest dose element called? Anybody? To what dose he called the weakest dose?
So just now, Madam explained that high dynamization of medicine laid dry upon the tongue is the weak and smallest dose.
No. Question is, which is the weakest dose? Tells us. It's dry dose and olfaction,
Perfection.
which is usually,
Dry dose, sir.
yeah, dry dose and olfaction.
Olfaction is a very, very helpful tool. I suggest that everybody learns to use it. For example, I can just give a short example. My son messaged me from school today. He's in yeshiva, which is a higher institution of religious learning for Jewish people. And he said that his friend is sick with a sore throat and he started coming down with a cough. I'm like, do you have your olfactory bottle of aconite? And he's like, hang on. He goes and looks through his bag. He's got it. He takes a sniff. An hour later, he calls me and says, homeopathy wins again. Right, Devira? Make homeopathy great again.
But then was this in potency
Trying.
You're doing a good job, Devira. You are. I see you posting, you're interacting, you're getting people interested. You're doing a great job, Devira.
Devera is in the room.
Yeah, she's in the room.
Yep.
Yeah, so that was in potency, obviously. That was a 30C. All my kids have a 30C of aconite that they have with them.
Okay.
And, you know, at the very first symptoms of ailment, that can abort any problems. Okay, so we have already seen that before proceeding, we cannot repeat the same dose because it's going to maybe even do more harm than good. But taking, we're going to continue here, but in taking one and the same medicine repeatedly, which is indispensable. What does the word indispensable mean?
Can't enter.
Can't do without it.
That's right. Yep, that's right, guys. It's indispensable to secure the cure of a serious chronic disease. So Hahnemann is telling us that we have to give the same medicine repeatedly, which we can't do without. It is an absolute must to secure the cure of a serious chronic disease. If the dose in every case varied and modified only a little in its degree of dynamization, then the vital force of the patient will calmly and as if it were willingly receive the same medicine in brief intervals, very many times in succession with the best results, every time increasing the well-being of the patient. So how do we do that? Has anybody been doing that in their practice?
Yes, ma'am, we have to redynamize now. So by doing successions.
Yeah, here in C scale, Hahnemann recommends stirring or shaking, not so much succussions, but more stirring and shaking. Boddinghausen does a lot of stirring with the spoon. So he says we have to do it. And he says that it is a good idea to shake the medicine that is in dilution 5 to 6 times before repeating the dose. Now here he's saying that we want to put it, I use disposable plastic cups. And you
Do you
put one
think,
pellet. Go
Do you
ahead.
think, ma'am,
Yes.
do you think shaking is different from succussion?
Well, succussion is done like hard against like a book or a firm surface, as opposed to just,
Okay, we have to recommend patient to take this 1 tablespoon from the stock solution after succussion or shaking.
well, it depends on if we're using C scale or LM scale. This is
Only
just
M.
C scale. We're only
Oh.
talking C scale today.
Oh, okay.
Okay, today we're doing C scale.
Okay.
So he says 1 pellet of highly potentized, well-selected medicine, as if we would give our patient anything other than a well-selected medicine. Would we?
Madam, may I ask one doubt?
Yeah.
In the starting, in the chapter starting paragraph, a small pellet of one of the highest dynamization of a medicine lied dry upon the tongue. Here, highest dynamization means, is it 1M in say C scale or LM scale? Highest dynamization means it will come into LM method.
I think that he's talking about 30C basically,
Okay.
because he worked a lot with 30C, then sometimes with 200 and higher. But generally speaking, like when he uses that X with the little circle, which he calls the decillion, that's kind of like a 30C. We saw that in that thing that we talked about, and it's in our Synicum. How to treat and succuss in order to bring it up to that potency, which is kind of like our 30C. Did anybody ever do that math problem? Sanjay, did you work out that math problem for us?
Which? I can't hear properly.
You got some of these?
Okay, can you repeat?
Last time we had our discussion, we were talking about the production of the X decimal potency, which is not decimal. It's not 1 to the 10. It is 1 to the 100, 1 to 99. And I asked everybody if they could please do this math problem from our Synicum in the chronic diseases to find out exactly what potency Hahnemann's referring to.
Arsenicum in Mater Medica Pura, he has mentioned.
Yes, and I did ask if people could do this math problem. Did anybody do it?
Oh, that's decillion. Decillion is 60,000 parts, something like that.
It's not though. That's why I asked everybody to do the math problem. I think I'm gonna have to ask my husband to do the math problem for us. Find somebody who can do math.
Yeah.
Anyway, it's something more along the lines of a 30C. Okay, guys? But Hahnemann did sometimes use the 200. I think he did try out the 1M. Boninghausen was like the main, what's the word? What's the word for somebody who promotes and does experiments with? What's the word for that in English?
Pardon?
I'm just looking for a word in English that isn't coming to my mind. Boninghausen did a lot of experiments on people and animals in the 200th and higher. And I forgot what that word is about being the main person who, you know, anybody? No? Okay, never mind. Okay, so 1 pellet of highly potentized, well-selected medicine in 5, 10, or 15 tablespoons of water. This is a European tablespoon. Okay, guys? And this is a cup. And when we use a plastic cup like this, it's disposable and we can just have people throw it away, as opposed to having to clean their metal cups or things like that with hot water. It's just simple. If you have these things available nearby your house, these things are readily available where I live. Dilution bottles are another matter. That's a hard one. Okay, so you want to put 1 pellet, put water in it. It's going to end up to be something like this. And you have people take the medicine as needed, which will vary. But sometimes Hahnemann is giving this once a day or once every other day, which is a lot in a chronic when people give a dry dose and then watch and wait. Isn't that right, guys? So many homeopaths are taught in school to give a dose of whatever amount of pellets and give it dry and then call the person in a week later. Did anybody else learn that in school?
Yeah.
Yep. Give that dry dose, high and dry, and then turn off your phone for your patient not to call you with their problems for a full month. That was what I was taught. Hide from the patient because the patient is going to have an aggravation. But rest assured that aggravation tells you that the medicine is working. Now, this is totally not what Hahnemann expected of us as homeopaths, which is shocking because all the later homeopaths had access to this very book, The Chronic Diseases. Everybody had it. So it makes you wonder why so few people, other than
Nobody reads.
Boninghausen,
Nobody reads.
are you going to tell us that all the great masters of homeopathy have not read The Chronic Diseases?
It's really shocking. Even such a repetition has even Kent also haven't mentioned. In acute, yes, yeah, in acute he has mentioned, but in chronic, whenever it is needed, he also tells give a dose and wait and watch for a long time.
And even in the acute, he's not saying to give it in water. He's saying to give it dry. Well, for those of us who like to have their patients as happy and comfortable as humanly possible without any aggravation, it is well worth our while to follow these directions by Hahnemann, because I, once upon a time, did the high and dry and wanted to turn off my phone. I know, yeah. So we want to make this very simple and gentle for our patients. Then he goes on to talk about rubbing the medicine into the body. Okay, so you make up the solution between redoses, which you have to gauge for yourself because we are intelligent and not negligent. And we have the industry and the ability to be masters of our art. We give our doses as needed with shaking it or well stirring it 5 to 6 times per dose, per redose. And then he goes on to say about skin application. I know some of you were not here for the man from Germany who talked about how he uses skin application. But Hahnemann here in the chronic diseases is going to tell us about it as well. You have to pick a body part that is what? If we're going to rub medicine on the body, what does the body skin have to be like? How does it need to be?
It has to be sensitive.
Sensitive, exactly. What else?
It has to be disease free.
Exactly. And that includes
It-
so if somebody has a pain or a spasm in the limb, we can't use it. It has to be a completely healthy body part that we rub medicine into.
You cannot rub medicine on skin diseases.
Yes.
Nor can you rub medicine on a body part that has pain or spasms. It has to be completely healthy. So if people have like, you know, rheumatism, but they have clear skin without an eruption, you still can't use that body part
Mhm.
because that limb is not completely healthy. It has to be on a place where there are no pains, no cramps, no cutaneous eruptions. And to alter and vary the body parts or the limbs. Thus the physician, I'm going to quote Hahnemann again, thus the physician will receive a greater action from the medicine homeopathically suitable to the chronic patient and can cure him more quickly than by merely internally administering the remedy. What does that mean, guys? When we alternate oral doses with doses rubbed on a totally fine body part, totally healthy body part, we are speeding the cure. We will have better effects than only giving the medicine by mouth.
And so you can use oral as well as rubbing.
Yes, that's what he's saying. Use oral, not on the same day, but alternate oral with rubbing.
Then I have a doubt here. Do we have to change the potency in that case? When we are
100%. Yes, we have to stir or shake.
Mhm.
Okay, 100%, very astute of you. Good job. Yes, it has to be a modified dose. That is always important. We never give the same dose twice, with the very few exceptions of sometimes we do it with, anybody know what medicines have an alternating action? that we know of that you sometimes need 2 doses? Anybody got that information on them?
Rustox, Bryonia, and I forgot the third one. It is there in the orphan.
Yeah, Ignatia.
Ignitia, madam.
Yes, Ignatia. Belladonna.
And Rustox.
Very good. Very, very good. Yes, so those sometimes we need to give in the same potency 2 times in a row. It's just because we don't want to discard the medicine and say, oh, that didn't work. We need to try it twice. But then after we've had that 2 doses, then we have to go on and redose as needed with modifications. We're always using the modified dose. Always using the modified dose. We never use the same dose twice. We're always changing the dose. And we always want the body to accept it new with a slight modification and secure the cure efficiently, effectively, and without aggravation the best we can. So Hahnemann, now I'll quote Hahnemann again. This mode of procedure, the rubbing, alternating with the medicine in the mouth, this mode of procedure has been frequently proved by myself and found extraordinarily curative, yea, attended by the most startling good effects. The medicine taken internally being at the same time rubbed on the skin externally. This procedure will also explain the wonderful cures and rare occurrences where crippled people get better with mineral baths. But then he goes on to give us a warning that such baths have killed so many people that it's amazing. So the limb must be free from cutaneous ailments. It must be free of pain, and to alternate the days to rub a small quantity.
Hello guys.
Camera, what do they call?
एक बार turn.
I figured it out. I figured it out. Okay, so we can rub it in, and for this purpose, the bottle should be shaken 5 or 6 times, as we already mentioned. So those are 2 different things that we can do. And then the following mode with careful patience, where he takes a bottle with a mixture of 5 tablespoons of water and 5 tablespoons of brandy, and 5, which is kept on hand in a bottle with 200, 300, or 400 drops, according as the solution is to be weaker or stronger, are dropped into a vial, maybe half filled with it, and which the medicinal powder or the pellet or pellets of the medicine have been placed. This vial is stoppered and shaken until the medicine is dissolved. From this solution, 1, 2, or 3, or several drops, according to the irritability and the vital force of the patient, are dropped into a cup containing a spoonful of water. This is then well stirred and given to the patient. And where more special care is necessary, only the half of it may be given. Half a spoonful of this mixture may also be used for the aforementioned external rubbing. Okay, so he's talking about how another option is to get together, mix together 5 tablespoons of water, 5 tablespoons of brandy, and then 200, 300, or 400 drops of medicine dropped into a little vial, and then use that into a second cup. So he's talking about an early version of the 2-cup method. And that again is stirred before redosing as always, and that we can use this mixture as well for rubbing the medicine. And every time the little vial must be briskly shaken 5 or 6 times. So also the drops of medicine with the tablespoon of water must be well stirred in the cup. So after we put our drops in a cup of the alcohol and water mixture, you then add some water and you stir it before the person takes it. And then he says the time of day where it's best. Anybody know what time of day Hahnemann is suggesting is the best time to take medicine in the chronic diseases? Anybody know?
Ma'am, you repeat the question?
Oh, what time of day does Hahnemann say is the best time to take medicine in a chronic disease?
What time you asking?
Yeah, what time? What time of day?
It's in the morning.
Ah, that's where it becomes very interesting, because in the Organon he mentions in the morning, and then here in the chronic diseases he tells us in the night before bed.
Oh,
So let me read that little paragraph. It's just a tiny little thing. Frequently, it is useful in treating chronic diseases to take the medicine or to rub it in the evening shortly before going to sleep, because we have then less disturbance to fear from without, and then when it is done earlier. So when we do it in the morning, the person has the whole day ahead of them where they might have disturbances. When you do it in the evening before they go to sleep, they're not going to have disturbances. No food is going to, they're not going to eat food. Nobody's going to upset them. They're not going to get any bad news. Right, guys? Less interference with the dose. Just like how Boninghausen told us when we were discussing recently in one of these little meetings, that the more interference a patient is likely to have in their daily life with their treatment, the more likely we are going to need to redose them.
but antisoric medicine, Hahnemann recommended administration of antisoric medicines in the morning. In
I
chronic
know, right? And now he's saying at night, because this is the appendix when he most recently, you're right. He says both. He changes his mind again and says to do it at night in 1837. I'm like stuck in the 1900s. Can you tell that? So yeah, so here he says,
Ma'am, which page it's in technical part of homeopathy?
yes, in
Okay.
this book, it's page 268.
268. Okay.
Yeah, so this is like a little bit of an updated version from the morning recommendation. Because yes, you're right, he said in the morning previously. Now he's saying that he's changed his mind, which he does. Hahnemann changes his mind and he redefines things and refines things from time to time to give us better information so that we can help our patients. So now he's saying to give it in the evening, shortly before going to sleep, because there will be less disturbance in the person's daily life. And then he gives us a little note about how he said that it might be too strong to use 10 succussions. Then he changes his mind again and says 10 succussions are okay. Hahnemann's always thinking, always trying new things, always experimenting, and always giving us updated advice about how much we should succuss, how much water we should use. He totally abandons the dry and weight dose, totally. Okay, and then we're going to sum it up with the last paragraph here. In cases where a great irritability of the patient is combined with extreme debility, and the medicine can only be administered by allowing the patient to smell a few pellets contained in a vial. When the medicine is to be used for several days, I allow the patient to smell daily of a different vial containing the same medicine. Indeed, but every time a lower potency, once or twice with each nostril, according as I wish him to be affected more or less. So that is super interesting there too, because he says that when you have a patient that is kind of high strung and not very strong, a very sick patient that doesn't have a very good vital force, that you can descend potencies through olefaction for best results using the C scale. But that, later authors have said what? When are you going to use, when you use a descending scale, what do later authors say you're doing? They say this is how to antidote a medicine. You heard that? Sanjay? Yoo-hoo. Many newer, more modern homeopaths say that when you go down a dose, that you're going to antidote the too strong effects. And Hahnemann says that no, this is the best way to deal with a patient that doesn't have a strong vital force and who is very debilitated. So we get a lot of conflicting information here from Hahnemann and newer authors. Anybody see that? Does anybody notice that? Is anybody following?
Madam, antidoting a medicine is by giving lower dose, madam. Is it correct method?
That's not what Hahnemann says here. He says to use this when you have a very disabled patient, not physically disabled, but somebody who doesn't have strong vitality, that you can go lower each time. But that wouldn't be lower, like, let's say you've given a 200, that's messed the person up going down to a 30. He's saying, like, give the 30, give a 28, give a 26, give a 24, kind of stepping down.
But now we don't have these kind of potencies, no? I mean,
No, actually, in that time, Hahnemann suggested to make their homeopath should make their own medicine.
mhm.
And these potencies are definitely available on the market, at least through places like Helios and Boiron and places like that. Those potencies are available, but we don't really have to do that. But just keep it in mind that it's not necessarily going to antidote your patient,
Mhm.
because there's like a lot of different things that we can do with the patient that is irritable, not irritable like, irritable, but that they're overexcitable. There's lots of other methods to do, just the, what you don't want to do is you don't want to make those big jumps. You know, we are usually taught in school, go from, a 30, see how that works, then go to a 200, then go to a 1M. But if we're following Hahnemann's directions in the chronic diseases, we're going to start with a 30. We're going to stir it or shake it 5 times, give it again. And we can do that a lot of times. Or we could start with a 200 and then we could give it 5 shakes, or we could give it, 5 good stirs and do that a number of times. We can even do that with a 1M. I do that sometimes with a 1M. I'll give a dose but I'm not going to do it like every day, every other day. I'm not. But, if it comes to be a month and the person needs a redose or whatnot, I will give it again just by, shaking it like 5 or 10 times. So there's a lot of different, this is where Hahnemann says it's kind of like an art. We have to know our art, right? As he said, I can only limit myself to the later case of chronic diseases intermixed with medicinal disease, as the other situations cannot be arranged in tabular form for the weak and the negligent, but must be left to the accuracy, the industry, and the intelligence of able men who are masters in their art. And that does mean women too. Man just means people. So we have to know when the patient needs medicine. We need to know when to redose, when to withhold the redose, when to give Saclac. This requires some skill and some art. So there we have had our review of C scale in chronic diseases. Sanjay, you have anything to say here?
No, it's almost done. If anybody has questions, we can answer them. Anybody? Shivakumaran?
Sir, pardon, sir.
Any
My network is-
questions? Huh.
So Tana, do you have any questions?
Madam, I will read from page number 155 to 159 next, and in next class I will ask doubts, madam.
Okay,
I will revise once in textbook. Afterwards, I will ask.
okay, sounds good. Yep, so the chronic diseases isn't LM potency, it's C-Potency, C scale. And the art of how to dose and redose is important to learn. And it is a little different than what we've learned in school, as we see. But it gives us much more control over the therapeutic usage of medicine. We have way more control this way. And that is really, really helpful.
Okay. We can assume that everybody is following and right? We don't have much questions. And
As long as the disease is progressing better, we don't need to redose. As soon as the progression slows, we can succuss, stir, or shake 5 to 10 times, depending on the needs of the patient. We could even do 2, 5, or 10. You have to gauge your person there, sitting there with you. And as soon as improvement slows, we can redose, but it can never be a static dry redose.
Right. Okay. I think we are almost done here. If Tikwa finish,
Do you know if I'm finished?
and that's why I am asking you.
I'm finished.
Yeah. And people also not having any question. We assume that everybody has followed well.
For your interest information, in aphorism 249, I think Hanuman mentioned, if you follow the organon well, there is no need to get the occasion to antidote medicines like that. He mentioned.
Yes,
If my memory is
100%.
correct.
Yeah, you're right. If we're very careful, we never need to use an antidote.
Yeah. Is there any evidence Hanuman mentioned that the same medicine in lower potency will antidote the higher potency of the same medicine?
No, Hanuman haven't said that. It's just an logical thinking of different homeopaths after
But,
Hanuman.
but Hahnemann says here, when we have a patient, a case where there's great irritability combined with extreme debility to go lower.
Yeah.
So this idea of it will antidote it, I'm not sure that it certainly isn't according to Hahnemann's instructions. But I know that people use it. I think you use that, Sanjay?
Yeah, many things like that. It's just an what do you say? Law of similar. Even some say that even the second dose will antidote the first dose.
Well, that's exactly why Hahnemann says that we only give medicine in water and only with succussion, stirring, or shaking between doses, because the effects of the first dose will then be nullified by the second dose.
Exactly.
Yeah, slight modification needed.
Yes, slight modification needed. Modification needed, absolutely. Never repeat the dry dose.
Hanuman also used the crude form of medicines, ma'am, like mother tinctures, and he used it in the same way. Like he added 1 drop of mother tincture in the 1 glass of water, and after 10 strong stirrings, he used it well in fever cases. Once I read in his writings.
In his very, very earliest works, he does discuss that. He gives us a lovely case where he shows us how he uses the materia medica pura and the proving symptom numbers in a case where there's a digestive disorder. And he does give a drop of bryonia in that case. But this is very, very, very early works of Hahnemann before he developed potencies to the degree that gave him satisfaction.
Yeah. But nowadays, many people, homeopathy doctors, using mother tinctures as a supplement like that they're using. But how many of you believe that using mother tinctures in the name of homeopathy medicine is according to homeopathic principles? Is it acceptable? What is your opinion from different peoples? We can, any idea, ma'am?
I have my opinion for sure. I do. I always have an opinion. Okay, what about other people? Sanjay, do you use these things?
Not actually, but often in some cases I used to.
No, sir. My question is using mother tincture, homeopathic mother tincture is right according to homeopathy principles.
No, their application actually does not follows the homeopathic principle. It's just like an giving a crude substance, like any of other. It's just an extract like that.
Yeah.
So it's does not follow that homeopathic principle.
Yeah, it doesn't have dynamic action. It can be similar and it can be the needed remedy. And we might want to consider using like that kind of medicine when somebody's dying or in totally incurable, terrible situations. You know, we might want to do that. And I don't see any reason why we wouldn't if we need to, because we need to make the patient comfortable when there's no longer any hope. But it isn't, you know, part of homeopathy is dynamization. The dynamized medicine is a very essential part of this medicinal system.
It is one of the principle of homeopathy. It itself proves that without dynamization, it's not homeopathic.
Yeah.
Yeah, so I